Hello class, good afternoon. So this week we'll talk about let's learn basic first aid. But before we learn the basic first aid, we should know first the injuries and the condition of this. So first is wounds. When you say wounds, these are cuts, scrapes, and punctures on the skin. So clean the affected area of the skin and apply antiseptic to prevent infection. For severe wounds, consult a doctor. So, if it is just a small wound, then you can treat it by cleaning the affected areas and by putting or applying antiseptic to prevent infection. But if it is severe and it needs to be treated by a doctor, then go to the nearest clinic or hospital. Number two is nosebleed. Nosebleed can happen as a result of a blow. In some cases, nosebleed are caused by hypertension due to the increase of temperature from the environment. So generally, nosebleed is the blood flows through your nostrils. So lumalabas yung dugo sa iyong ilong, and people who experience frequent nosebleeds, it means it is no longer normal, without cause should immediately consult a doctor. So minor nosebleeds do not require frequent attention. In case of nosebleeds, follow the setup given below. So in case that you experience nosebleed or you see your friends, okay, having this condition, then do this one. First is let the victim sit on a chair and lean him very slightly forward, then press the soft part of his nostrils and have him or her breath through the mouth while doing this. So you have to press the soft part of the nostril, and the victim should breathe using his mouth or through his mouth. And the second one is if bleeding does not stop, then press the bleeding nostril again with cold or wet cloth for 5 minutes. But if there's no progress after doing this, then place a gauze on the bleeding nostril and then seek medical help. So if there's no progress after doing the first step and the second step, then call for a doctor or seek medical help. Number 3 is insect bites. So the common insects that first is some people are allergic to certain kinds of insect bites like bees, wasps, and ants. Severe reaction might lead to the victim's death within 1 hour's time. For non-allergic people, they usually experience pain, redness, and itchiness. So insect bites is can cause severe reaction to people allergic to it. So here are some common first aid for insect bites. First is examine the area stung by the insect. If it is a stinger penetrated the skin, do not force the stinger out because it will only result to penetration of more venom into the body of the injured. Next is place ice on a stung area to relieve pain, redness, and itchiness. So, you have to place ice on the part na kinagat ng insekto, and The third one is observe the victim's skin for at least 30 minutes for signs of allergic reaction. So if the victim experience dizziness, vomiting, stomach pain, immediately seek medical attention. So go to the nearest clinic or hospital, and if it is necessary, then perform the rescue breathing. Next is animal bites. So animal bites from dogs, cats, rats, and even humans can result to tetanus. If the animal who bites someone gets sick or dies afterwards, so it may carry rabies that can be fatal. So when you say rabies, it is a serious viral disease that can be transferred from one person to another. So how can you perform first aid? First is wash the animal bite with soap and water. Number two, since the major concern in the animal bite is bleeding, put antiseptic cover the wound with clean and dry cloth or gauze. And the last one is go immediately to the nearest hospital. So let's proceed to burns. So injuries caused by exposure to chemicals like hydrochloric acid, hot liquids, electricity, fire, and sun rays. So burns are classified according to degree of damage. So it is first degree burn if the surface of the skin reddened and painful. It is second degree burns when the surface burns in which the second layer of the skin called the epidermal layer is affected, resulting to blisters and reddening. So ang blisters ay ito yung parang lumobo, okay? Yung napaso. And the third one is third degree burns damage the outer and underlying tissue of the skin. These severe burns which needs urgent medical attention. So, what are the first aid for burns? So, the first one is place a clean cloth over the burned area. So, to avoid infections or coming sticking dust with the burned area. Next is if fibers of the clothing are stuck to burn, do not force to remove it. And the next one is avoid breaking any blisters to prevent contamination and infections. So, yung parte na lumobo, wag mo yung bibitakin so that you can avoid contamination and infection. And if the face, hands, and arms or feet are burned, place ice packs on the affected areas. So immediately if you experience it, put ice packs on the affected areas. So it will lessen the pain.